Hello everyone, welcome to ORTC Repertory course 2022. My name is Dr. Smita Mahajan and I have been practicing homeopathy since last 15 or more than 15 years, and I'm currently practicing in Canada. I'm a registered practitioner in Ontario, Canada since 3 years now. I welcome you all for this ORTC Repertory course. This is a fantastic opportunity which Dr. Kalathia and team has created, and he has taken immense efforts for creating this course with his rubric exercises and the case exercises. And I have attended his course last year, which helped my repertorization skills in a very fantastic way. At the end of the course, I was really I fell in love with the repertory, and I'm sure you guys would all agree to that. At the end of the course, you would all find repertory is a fantastic fun learning tool which helps you in finding the simillimum. I thank Dr. Kalathia sir for giving me this opportunity to be a mentor of your group. And let me share my screen. Yes. So what is repertory, friends? As we all know, repertory is an English term for the French term repertoire, which means a storehouse. It's an index of symptoms which quickens the process of reaching to the simillimum. Homeopathic repertory is a book of index of symptoms of homeopathic materia medica arranged in a definite manner with or without gradation to facilitate the selection of simillimum. So as you can see in the picture, these are all the tools. So what are the tools for coming to a simillimum? Case taking, individualization, remedy selection, the genius of remedy, and the potency selection. And repertory is one of the tools which is very helpful in our practice, and it can help you fix the most difficult cases in an artistical and skillful manner if it is used artistically. So what are the advantages of repertorization? Repertorization or homeopathic repertory is very useful or advantageous to select the right medicine. It increases the knowledge of your materia medica. It helps you to find out the simillimum. It's a reference book. It helps to find out complete symptoms, and it is also helpful for selecting a drug based on a second prescription. So say for example, the first prescription didn't work, then what do? Then we go back to a repertorization chart, and we go back and we can make a choice for the second prescription. So how do you classify homeopathic repertories? The classification of homeopathic repertories is based on two things. First is, it is based on inductive logic or factual repertorization. This term factual repertorization I learned from Dr. Kalathia sir's repertory course last year. So inductive logic is a scientific way where where universal conclusion is drawn from particular premises. So let me give an example. So doctrine of drug proving is based on inductive reasoning. So where which is based on actual facts, which we cannot interpret in any other way. So it is also called as factual repertorization. So it is based on actual facts. So first we make observations, then we recognize a pattern, and we conclude a generalization. Next is conceptual repertorization or deductive logic. So what happens in deductive logic? So we first observe from the available facts, we use them as a base, we draw a valid statement, and we form an effective conclusion. So for example, if I say all flowers in the bouquet are red, and I give a statement that roses are red, that means it's our interpretation that all the flowers in the bouquet are roses. So that is called as deductive logic, where you are interpreting certain things from the given fact. So how do we use the repertory? So for using repertory, what do we need to know? We need to know the structure of each repertory. We need to know the rubrics. We need to know how to convert patient's language into rubric. We need to know the zeroing down of the rubrics and repertorization based on evaluation and how to form a totality. Then we have to analyze the case. We have to understand the core of the patient based on our observation and case taking skills. And then we need to differentiate the remedies, and then we select a proper remedy. So for rubric hunting, for efficient repertorization, we need to read the repertory, we need to understand the rubrics, know the meaning of the rubric. If you don't understand the meaning of the rubric, you can go on Google and search in the dictionary, or you can search in the dictionary, and you can know the meaning first. You need to convert patients' language into rubrics. So learn at least 10 rubrics every day as an exercise. This would be my suggestion for you all. Then read the materia medica of that remedy. So for example, we are learning pulsatilla. We know that, so what rubrics come under pulsatilla? Pulsatilla has majorly the rubric carried desire to be carried slowly. We all know pulsatilla is a patient who is mild, who needs support, but in a gentle way. So she wants to be carried, but she wants to be carried slowly. So now we know why this rubric is coming in that remedy. When to use which repertory? Now this is an art, and each case is different, and each case is going to teach you which repertory you need to use. So that will come out of experience. So use BBCR. So our first choice is BBCR when there are no prominent mental symptoms, and when there are symptoms based on location, sensation, modality, and concomitance. That is LSMC, which we say in short form. Then when do you use Kent's repertory or complete repertory? When there are mind symptoms more prominent and more of physical symptoms. When do you use Fatak's repertory or keynote method? Where there are very few symptoms, where most of them are common symptoms. Fatak's repertory is used in acute cases more prominently. And when do you use Borik's repertory? Borik's repertory is used when patient comes with the name of the disease and he is not able to give any much details about any other details, and he is coming only with the pathological generals. So this is Kent's repertory. Kent's is the oldest repertory based on deductive logic, and this means the first importance is given on generals and then the particulars. If a case has lot of qualified mentals, we use Kent. Mind and physical generals are given importance. So my first case where I used Kent's repertory, This is a case of gastritis. It's a 28-year-old patient who comes with symptoms of gastritis, excessive burping, and stomach pain. After case taking, this was my observation. I evaluated the following things. She was a very anxious person. I came to know this because I do my case taking, I mean the consultations either in person or on Zoom, and this patient had opted on Zoom, and I saw that she had logged in on the Zoom meeting half an hour before the actual time of the Zoom meeting. So so on questioning, she told me that she has the anticipatory anxiety. So she feels very anxious before any appointment or meeting. So she will start rushing ahead of time. Upon further questioning, she had fear of high places. She said she was an introvert. She had aversion to being with people around her. She was reserved by nature. She had a lot of anxiety when the time was set, and she had to finish a given task. During case taking, she paused in between and she was hunting for words. So here it is our skill, how we observe and what things we read in between the lines. So this was my observation, like when in case taking, she was pausing in between and she was like, she couldn't express, she couldn't put the right words. So she was hunting for words. Her physical journals where she had a strong craving for sweets. Her particular or characteristic symptoms were she used to get a lot of burping after eating sweets. And one PQRS symptom which I noted was she had pain in stomach on mental exertion or whenever she got stressed. So whenever there was exam or whenever there was some stressful or anxiety like situation, she used to feel the stomach pain. So this was my repertorization chart. I have taken these following rubrics. Mind, so it is from Kent's repertory, mind chapter, anxiety, anticipating and engagement. Mind, hurry, time for the appointment to arrive, appointed to arrive. Company aversion to forgetful words of while speaking. Eructations loud, eructations empty. When stomach pain, mental exertion on. So this was very particular characteristic symptom. Eructations, sweets after. So this was also a characteristic symptom. And mind anxiety when time is set. If mind anxiety, high places. Fear, anxiety, high places. So as you can see in the chart, argentum nitricum is coming in, has got the highest number of symptoms. So argentum nitricum was covering the totality of symptoms, and my prescription was argentum nitricum 1 mg twice a day for 2 days and followed by SL for a month. And when after a month's follow-up, the patient had was much improved. Still, she was getting burping, but the frequency and intensity had reduced. There were no episodes of stomach pain, even on stress this time. She was continued on argentum nitricum for a few months, and the dose was repeated only twice in 4 months' time, and the patient improved significantly. And she did not have any burping and other issues, and the gastritis symptoms were solved. Now this is Boger-Bonning-Hussins characteristic, BBCR. So if the case totality points a lot of physical generals and concomitants, we use BBCR. So the totality of symptoms is a complete symptom on one grand symptom based on location, sensation, modality, and concomitants. Together, they form a grand totality of the individual. So when do we use a BBCR? In short, when a case history is short. In cases where there is paucity of symptoms with no mental symptoms. Cases with pathological symptoms or objective symptoms. And cases where modality and concomitants are prominent. For example, fever cases. Case example for BBCR. This is a case of chronic cough. A 5-year-old boy suffering from chronic cough since 15 days. Cough begins as tickling in throat. Tickling is and spasmodic and paroxysmal cough. Paroxysms are of 2 or 3 like paroxysms come in 2 or 3 bouts. Cough is aggravated at night time. And what is a type of cough? So this is a classical feature which we see in BBCR where they have categorized it. So when we go in BBCR, we can see cough type catarrhal. So catarrhal means it started after catching cold and coryza. Cough with rattling in chest. So he was also having lot of rattling in chest. Cough sometimes with vomiting of mucus, and that ameliorates. So you can see this repertorization chart. Expectoration difficult, cough catarrhal, cough night time, night aggravation, cough tickling, concomitants, chest rattling, cough excited or aggravated by air or cold from, cough excited aggravated by winter in, cough excited or aggravated by lying down, retiring, cough excited or aggravated by throat tickling, irritation, concomitants, vomiting, and aggravation, nausea and vomiting, aggravation, hawking up, aggravation and amelioration. So amelioration, hawking up mucus. So analysis of the case, as per the chart, we see Nux vomica pulsatilla chamomilla. Now what do we give for this case? So Nux vomica was covering the totality of symptoms majorly. Differential diagnosis was pulsatilla and chamomilla. Nux vomica was selected as the patient, the child was very chilly. He was better by warmth and he was very fastidious by nature. His parents told that he needs everything to be tidy, neat and tidy. Even if he plays with some toys, he needs to keep them back after playing as soon as he will not make a mess. So he needs, so that fastidious nature, which was very interesting to see in a 5-year-old boy, that was a prominent. So I chose Nux vomica 30, 3 pills, 3 times daily. Follow up after a week, the boy is doing much better. Nighttime cough is better. The bouts are reduced and he's able to sleep. Now this is Bogus synoptic key. When do you use Bogus synoptic key? When there are more pathological generals. If the case totality points towards pathological generals, we use Bogus approach. Pathological generals, case of migraine headaches. So migraine headaches aggravated by light noise and better by sitting in dark room and sitting quiet. So these are the pathological generals. That time we need to use the Bogus approach. Fatak. So Fatak's a concise repertory of homeopathic medicines arranged by Dr. Fatak. This is a alphabetically arranged repertory and it is based on Bogus synoptic key. So when do we use vertex repertory? Vertex repertory is not used for finding characteristic local symptoms. You should avoid using vertex repertory when you have clear mentals or well-described characteristic particulars. So when you have very clear mental symptom or very characteristic PQRS symptom, do not use vertex repertory. Use vertex concise repertory when the generals are prominent. When you have a case with obvious fear of action, global sensations, similar symptoms in several parts that are generalized, that can be generalized. Approach here is one clinical symptom and one peculiar individual symptom. So if you have just one clinical symptom and at least one peculiar individual symptom, you can use vertex repertory. Now, case example for vertex repertory. This is a case of chronic urticaria. A 30-year-old male comes in chronic urticaria. He called my office. He wanted to be seen urgently. He said, "Please help me, doctor. I am in distress and I am getting these allergic rashes with severe itching all over my body. And I need to take 3 cetrizines, that is anti-allergic tablets, every single day." And he was quite frustrated. So on case taking, he said, "I am very restless most of the times. I don't like to waste time." So he was basically, he was a person who was very restless. He wanted to use his time for, he always used to think more of his finances, how to make more money. He was very, all his thoughts were revolving around his financial security, how to make more money, how to achieve a lot of things in life. And that's why he was very restless. He was doing 2 jobs. He was also working in night shift as well as day job. He was doing the stocks. He was a person as a stock agent or something, where he had to keep up every minute the track of what is happening in the stock market. So you can imagine how restless and how active this person was. So these are some pictures of urticaria. He had several red rashes, several very severe itching all over the body, and the itching used to come majorly at night, and it used to be sometimes very bad. He could even bleed after itching, and there was a lot of burning when he scratches. So he also mentioned about his nature. If you see, he said he was very straightforward. He was very blunt. He said that if he felt that something was not right, he would directly tell to that person in a very critical way. So he said that he would even go to the boss and tell that something is not right. Or even when he was a little kid, when I explored the history, he said that he could even go to the teacher and tell that this was not right, or he was very in a bossy way, or he had even gone on physical terms with a teacher of him, during the school days. So this was his mentals. Now you can see the repertorization chart. So when we repertorize the case, we use vertex repertory. So vertex repertory is arranged in alphabetical order. So you need to go in U. So say type urticaria, hives, wheals, itching, scratching, aggravation. Itching, scratch, must, bleeds until, time, aggravation and amelioration, 12 midnight aggravation. So he told me that itching is worst at midnight, 12 to 1 a.m. And avaricious, greedy and miserly. So this was the mental symptom which I noted by case taking. And he was critical, exacting. So this was also found as a rubric in vertex repertory, critical, exacting. carried desire to be fast. He wanted to be seen very immediately and he wanted immediate relief. So this was his nature. So that means carried desire to be fast. Then he was restless and anxious. So as you can see in the repertorization chart, arsenic, calcarea, rust ox are coming up, but arsenic is covering most of the majority of the totality of the symptoms. And as per the periodic table, we can see arsenic here. It comes in the fourth row of periodic table, where we see task, work, security, financial aspects are more concerning for these people who belong to the fourth row of periodic table. So arsenic album 30 given TID for a week. Followed up after a week, the patient's urticaria improved by 40%. So the potency was increased to 200 twice a day for 2 days and followed with LM potency 0/1 for a month. Patient reported much improvement up to 90%, arsenic album 200 or 1M repeated infrequently, and he was kept on LM 0/1 and 0/2 for a long time. This is Bogus repertory. It contains clinical symptoms, clinical rubrics based on nosological diagnosis. It is most popular bedside repertory. It also contains single remedy rubrics. It is used in incurable cases where you want to find a palliative remedy. So it's a bedside prescription. Murphy's repertory. It's also used for bedside prescription. Like Kent's repertory, Murphy's repertory is also based on Herring's guiding symptoms. It is enriched with clinical rubrics and pathological journals. One interesting section which I found in Murphy's is there is constitution as well. Like there is a section called constitution, which I did not find in any other repertory. Now complete repertory. Complete repertory is an extended version of Kent's repertory by Roger Zandvoort, as he found lots of missing information in Kent's repertory. And complete repertory is the latest repertory. It is the most commonly used repertory for classical cases, where we have to find the totality of symptoms with along with mind symptoms. Now this is a case of PCOD and infertility. A 35-year-old female suffering from menstrual irregularities, hair fall, mild acne, abnormal facial hair growth. She was married since 7 years and they were trying to conceive. They were unable to conceive. And the ultrasound reports showed cystic changes in both the ovaries. So she had polycystic ovarian disease. The physical generals were obesity, feeling lethargic, low energy. So mentals, she was reserved. Okay, so this so particular symptoms where mentals were suppressed, irregular, late and scanty. She had acne, hair fall, heaviness, which was felt in the pelvic region below the umbilicus. And pathological symptoms were cysts in ovary and hirsutism. The mentals were very interesting. She was very sad, tearful while case taking. So she was almost weeping while telling her case. She told me that she had suffered a lot of abuse in her family from mother-in-law and her husband. she used to get angry, or the typical scenario in Indian, or probably I shouldn't be saying Indian, or typical scenario which we see the mother-in-law and daughter-in-law relationship. So she used to get angry, but she could not answer them back. So she was not a person who would give back answers. This feeling was remaining in her for long years, and she couldn't, so she had a lot of pent-up emotions, lot of anger, vexation. She had the feelings of she had not been valued. She was not being given respect. She was treated badly. Silently, she was tolerating everything. She felt sad, lonely, and helpless. So when I repertorize the case, as you can see, I have taken these rubrics: heaviness, ovaries, left. She also complained of leukorrhea, yellow in color, menses before. Her menses were irregular, menses late too, menses suppressed, menses scanty. Themes of loneliness, anger, authorities against, abuse, aggravation, ailments from, helplessness, weeping and tearful mood, thoughts at sad, female genitals, tumors, cyst, ovaries, so cystic ovaries, menses suppressed from, neglected, ailments from, aggravation from being, and hairy chin, women in. So these rubrics were taken, and this was the repertorial chart which I made, which I got these three prominent remedies: Lycopodium, sepia, pulsatilla, calicap, natromur, and lac defloretum. So these were the remedies, as we can see on the repertorial analysis. So now what do we select? How do we select our simillimum here? So here, as I analyzed the case, I could feel that she was sensitive, emotionally very sensitive, because she was crying. So pulsatilla could have been one of the remedies, but I differentiated it with others because here I could see a strong victim and aggressor feeling. So according to the kingdom analysis, we know that where there is a strong victim and aggressor feeling, it has to belong to animal kingdom. And how do we analyze now? Suppose we come to animal kingdom, and then when we add animal filter chart to our chart, we got sepia, lachesis, lac defloretum, and apis. Now, how do we differentiate? Whether to go with sepia, whether to go with lachesis, or it's a lac defloretum. So what is the feeling of mollusk? Mollusk is, they feel withdrawn. They want to go back into the shell. They feel like pulling in self. They feel like retracting. They feel like the outer world is very dangerous, whereas as well as when they go retract in their shell, that also is suffocating for them. So they are not able to decide what they want, whether to go out or to stay in. So that is the main feeling of mollusk. But this feeling I couldn't see in my case. I could neither see a case of reptiles, like in reptiles there has to be an issue of superiority or issue of competitiveness. There was nothing like jealousy or superiority and inferiority and having jealousy towards other. There was nothing of this sort. The patient was very mild, docile kind of girl, and who couldn't give back. So this has to be a mammal. So in mammals, we see a strong versus, so what is the, so there is a victim and aggressor feeling, strong versus weak, dominating versus, so issue of hierarchy, higher versus lower, boss and worker. So persecutor and persecuted. So we know that this was a prey mammal. So why a prey mammal? Because she was telling me that she had been dominated. So the comparison of strength, the issue is not about what affects them, but who affects them. So it's all about domination. He dominates me, he controls me. So here in this case, the problem lies with the other person. So she always told, my mother-in-law is a problem. I cannot bear, I cannot stand her. She is the only problem in my life. So I cannot talk anything in front of me. Whenever I see her, I just get scared. I feel frightened, and she keeps torturing me with some harsh statements. She will talk about me, my family, like that. And this girl used to keep quiet and listen to it, and come home and like think about it. And whenever she used to think about it, she was having that pent up emotions. There was anger issues, but she couldn't do anything. So this is a victim aspect. So sudden fear, fright, intense, overpowering fears. She was troubled, tortured, teased. So this was completely a victim aspect. So this was a prey mammal. So the patient was very mild, submissive. She could not express herself. She was a giver and she was a doer of family. She said, I'm giving so much. I'm doing so much, but in turn, I'm not getting any respect. I've been looked down upon. My co-sisters are not giving me any importance. Everyone in my in-laws side looked down to me. Like, this was her main issue. So lac defloretum was coming up. So when we explore lac defloretum, I'm very thankful to Dr. Kalathia sir's mammals books, in which he has explained very nicely about all the mammals. I would recommend each one to purchase the mammals book of Dr. Kalathia sir, and it explains beautifully how to differentiate mammal themes. I'm also grateful to Dr. Mahesh Gandhi sir and Dr. Anita Salunkhe madam, a lot of great homeopaths from whom I'm still learning, and I keep constantly learning. Of course, Dr. Shankaran sir, where we learned the basics of homeopathy and all this miasms. So when we see lac defloretum, it belongs to Bovidae family, and it's a prey mammal. And what is a miasm? It's a malarial miasm. So malarial miasm means you are just bearing and bearing, and you are there comes a point where you just give up. Like you, it comes in between acute and psychotic miasm. So you try to live with it. You can't do anything, so you're helpless. So you are just bearing with it. So so this lady, her basic nature was calm, quiet, docile, emotionally sensitive. She was silently tolerating, holding grudges, but she couldn't express. She avoids quarrels. That is malarial miasm. So my prescription was lac defloretum 1 m 2 doses for 2 days, followed by SLBID for a month. For the first follow-up, patient emotionally feeling better. She's not thinking about the negative thoughts. Second follow-up, menses became regular for the first time. She was very happy. Menses have been regular after a long gap. So she is doing much better. Her bowels have improved. She's continued on SL. Third follow-up, she's doing much better. Sleep, appetite, everything improved. Hair fall is reduced. These are the ultrasound reports. So first report shows PCOD in both the ovaries, right and left, and this was after 4 months. There was no, so as you can see, there is no PCOD like changes. There is no cystic changes in the ovary, and it is completely normal. After 5 months of treatment, the patient called in to share her good news, and she told me that she had conceived, and the couple was very happy. They were happy that they had conceived naturally. Emotionally also, the patient became stronger and happy. So never stop learning and never stop growing. So thank you very much. I would like to thank Kalathia sir for giving me this opportunity, and I thank each and every mentor of this group, and I also thank Dr. Shankaran sir, Dr. Gandhi sir, and all the legendary homeopaths from whom I have been learning, and for my journey so far. Thank you very much, and I wish you all the best.